Vaccinating early in the morning, immediately after sunrise or after the light has been switched on, will also stimulate the chickens to drink the vaccine water quickly. Finally, we would like to point out situations in which drinking water vaccination should be discouraged. Vaccination against coccidiosis should not be performed with drinking nipple or cup drinker systems. The oocysts in the vaccine water may settle in the pipes around the nipples, thus making the vaccination unreliable. In principle, animals younger than 14 days should never be vaccinated via drinking water, because the uptake of water is too irregular at that age. Vaccination against coccidiosis is the exception to the rule. This simply must be done on day 4 or 5. All in all, this means that if not all requirements for a completely reliable drinking water vaccination can be met, the risk of failure is too high, and an alternative method must be opted for. The following 2 sections present complete instructions for drinking water vaccination. One section addresses vaccination via a trough system, the other via a drinking nipple system. The following steps must be taken. All drinking troughs and drinkers must be cleaned and dried out in advance. The systems must, of course, be completely free from detergents and disinfectant residues, as these could damage the vaccine. As stated before, an essential precondition of reliable vaccination is that the animals must have been prevented from drinking for 2 to 4 hours. Only then can it be guaranteed that the animals will drink the water quickly enough, that is, within 2 or at most 2.5 hours. The quantity of water in which the vaccine is to be dissolved mainly depends on the animal's age. A rule of thumb is that for each 1,000 animals, 1,000 doses of vaccine must be dissolved in the volume in litres of water equivalent to the age of the chickens, i.e. 25-day-old chickens require 25 litres per 1,000 birds. This applies to chickens up to the age of 40 days. For chickens older than 40 days, the maximum is 40 litres of water per 1,000 birds. In some cases, for instance for vaccination against infectious bronchitis, gumboro and salmonella, the addition of approximately 2 grams of skimmed milk powder per litre of water may improve the stability of the vaccine antigen. Incidentally, there are special stabilizers and special skimmed milk powders for use in drinking water and spray vaccination. The required quantity of vaccine is first dissolved in a smaller quantity of water. Open the vaccine bottles underwater to rapidly dissolve the freeze-dried vaccine pellet. The concentrated vaccine solution is added to the pre-measured quantity of vaccine water. This solution is thoroughly stirred and subsequently distributed via the drinking water system. drinking nipple systems must of course also be drained in advance to prevent the animals from drinking. To achieve this, the system is turned off. Next, the pipes are raised and the tap at the end of the line opened to allow the system to drain. This way, it is possible to check at the same time whether all the pipes of the system are open and clear. As stated before, chickens need to be thirsted for a period of 2 to 4 hours. Effective vaccination requires that all animals drink sufficient vaccine water within 2 to 2.5 hours. First of all, the required quantity of vaccine is dissolved in a smaller quantity of water. The use of powdered milk or stabilizer powder in systems with drinking nipples or cups with nipples is not advisable as it may clog the system. Skimmed milk is preferred in these systems, in a concentration of 1 litre of milk to 50 litres of water. When using skimmed milk, the pipe system must be rinsed thoroughly after vaccination to prevent the growth of microorganisms in the pipe. Open the vaccine bottles under water to rapidly dissolve the freeze-dried vaccine pellet. The concentrated vaccine solution is added to the pre-measured total quantity of vaccine water in the central water tank. Here too, the rule of thumb is that for each 1,000 birds, 1,000 doses of vaccine must be dissolved in the volume in litres of water equivalent to the age of the chickens, i.e. 25-day-old chickens require 25 litres per 1,000 birds. For chickens older than 40 days, the maximum is 40 litres of water per 1,000 birds. The solution is stirred vigorously before the drinking water system is opened. Only once the nipple lines are fully charged should they be lowered again. This ensures that all chickens immediately have access to the vaccine water. In hot conditions, broilers drink copious amounts of water. Under these circumstances, it is advised to increase the quantity of water and dispense the dissolved vaccine in 2 successive cycles. First of all, half the quantity of vaccine is prepared and administered to the chickens. Immediately after they have drunk this, the second half is prepared and dispensed. Highlight tablets, which colour the vaccine water blue, can be used as a simple check on whether all chickens have been vaccinated. The vaccine water colours the beak, tongue and crop of the chicks blue. These highlight tablets can also be used to check whether the vaccine water has reached the end of the lines. These days, dosing systems are often used for drinking water vaccination. In that case, it is important that the system is adjusted accurately to ensure that all chickens are administered with a sufficient amount of vaccine. Nobilis Cox ATM vaccine against the parasitic infection coccidiosis consists of a solution containing chlorophyll in which oocysts are suspended. Oocysts are the eggs of the coccidia. The chlorophyll gives the vaccine its green color. Nobilis Cox ATM can be administered using the spray technique or via drinking water, but spraying is the preferred method. Contrary to standard practice, drinking water vaccination should be performed on chicks that are 4 to 5 days old. The vaccine must always be dispensed to young chickens in round drinkers or chick fonts. The nipple system is not suitable for coccidiosis application, as the oocysts tend to settle in the pipes around the nipple inlets, resulting in unreliable administration. Depending on the weather conditions, the chicks must be prevented from drinking for approximately 1 to 2 hours, but not too long given their age. The vaccine must be diluted with water in a ratio of 1 to 100. The oocysts rapidly settle in the diluted vaccine liquid, so thorough stirring after dilution is imperative. The solution must also be regularly stirred or carefully shaken during vaccination. Approximately 5 milliliters of the vaccine solution per chick is poured directly into the drinkers. Given their age, it is advisable to calmly herd the chicks to the water bowls to help them to discover the vaccine water as quickly as possible. The ocular and nasal vaccination methods are among the best techniques for live vaccine administration via the mucous membranes. Using this method, every animal will receive the proper dose of vaccine, guaranteeing rapid and uniform immunity. However, these vaccination methods are quite labor-intensive. The ocular and nasal methods are used for vaccinations such as IB, ND, ILT and TRT. Ocular nasal vaccination should be performed in accordance with the following instructions. Dissolve the vaccine in the appropriate sterile diluent. This diluent comes complete with a special dropper. Here at this Thai company, they use a special dropper with ice. a blue dye has been added to the solvent. This facilitates an easy check of whether every animal has been vaccinated. A vaccinated chicken will have a blue tongue, even in the case of ocular vaccination. 1 drop of the dissolved vaccine is administered into the chicken's eye or nostril. If necessary, keep the lower eyelid fixed with your thumb so that the chicken cannot close it during dripping. To prevent damage to the eye, do not touch the eyeball with the dropper. For nasal vaccination, keep one nostril closed so that the vaccine will be taken up more easily. Ocular nasal vaccination can be applied to animals of all ages. Preferably, hold the dropper absolutely vertical during vaccination. This way, the drop size will be the same and accordingly, the number of doses constant. Work calmly, especially when vaccinating older animals, in order to minimize stress. To achieve a rapid, solid immunity with ocular nasal vaccination, every chicken must be vaccinated. Ocular vaccination is also possible these days using semi-automatic vaccinators. Usually, this equipment is suitable for a combination of vaccination techniques. This vaccinator is used to semi-automatically perform both ocular vaccination and wingweb vaccination. Finally, we will briefly present 3 remaining individual vaccination techniques. These are wingweb vaccination, follicle administration, and oral vaccination. Because of its effectiveness, the wingweb method is preferred for vaccination with Nobilus ovodiphterin against fowlpox and for vaccination with the combined Nobilus AE pox vaccine against avian encephalomyelitis and pox. The lyophilized vaccines are dissolved in the solvent using the special adapter that is supplied with the vaccine. If desired, the chicken anemia virus vaccine, Nobilus CAVP4, can be added for a combined vaccination. The wing web method can be used in animals of all ages. The vaccination needle is completely submerged into the vaccine solution and then inserted into the wing web, as you can see here. The needles are inserted through the underside of the wing web, not through the feathers, as this might cause loss of vaccine. The vaccination needles may not be inserted into the muscle either, as this might cause the vaccine virus to be washed away by the bleeding. Take care when wiping the vaccination needles against the edge of the bottle, otherwise too little vaccine remains in the needle reservoirs. As we have said, the wing web method can be used for animals of all ages. When animals younger than 2 weeks old are vaccinated, we recommend removing one of the 2 needles and vaccinating with 1 needle only. As shown when we discussed ocular vaccination, the wing web method can also be performed using semi-automatic vaccinators. The individual oral vaccination method is almost exclusively used for vaccination against AE in chickens of between 8 and 16 weeks old that are kept in floor housing systems. Usually, approximately 4% of the flock is vaccinated, and the vaccine virus is then spread to the other birds via their droppings. For this method to be effective, the chickens must be in mutual contact and be able to ingest the vaccine virus via the litter. That is why oral AE vaccination may not be performed in battery cages. This method is also not advisable when the animals are kept in houses with floors made entirely of wire or grids. In this case, we recommend drinking water vaccination. Follicle administration is hardly ever used in chickens these days, although it is recommended for vaccinating pigeons against pigeon pox. This vaccine, Nobilis pigeonpox, is dissolved with solvent using the adapters supplied, in the same way as with the wing web method. For vaccination, carefully pull out approximately 12 feathers from the bird's thigh or breast in such a way that the follicles do not bleed. Then use the vaccination brush to apply the vaccine over the open follicles. Vaccination on the thigh is preferred because the feathers are finer than on the breast and checking for emerging pox is easier. Moreover, vaccinating on the breast may cause irritation of the wing muscle. To round off this program, we would like to present some general recommendations that apply to all of the vaccination techniques. It is essential that only healthy animals be vaccinated. Make sure that the vaccine is kept and transported in accordance with the instructions on the package insert. Also, check the expiry date. Always use the appropriate diluent. This is vital, so when in doubt, ask expert advice. Always stick to the correct dose, 1 dose per animal.